For the last chapter, we will be discussing about the reproductive system. Basically, with the reproductive system, human species could not survive without functional male and female reproductive systems. And these systems actually play essential roles in the development of the structural and functional differences between males and females. They influence human behavior and, of course, the production of offsprings. However, a reproductive system, unlike other organ systems, is not necessary for the survival of an individual human. So for the reproductive system functions, basically it is for the production of your gametes or your sex cells. It is also responsible for fertilization. It is used for the development and nourishment of new individuals, like the production of milk, and of course for the production of the sex hormones. For the major reproductive organs between the males and the females, for males, we have here what you call your seminal vesicle. Next, you have the prostate gland. You also have the ductus deferens. And then you have the epididymis, the testes, and the penis. For females, we have the mammary gland found in the breast. You have your uterine tube or the fallopian tube. You also have your ovaries, the uterus, and the vagina. For the formation of gametes or sex cells, when you say gametes, it is actually what we usually know as the sex cells. So we have the sperm in males and then oocytes or eggs in the females. And in the formation of these gametes or sex cells, we call that process meiosis. This is actually a special type of cell division that leads to form the sex cells. And each sperm cell and each oocyte contains 23 chromosomes from the process itself. So do you know that the largest human cell is the female egg, and the sperm is actually the smallest type of cell found in the body? So this slide shows you the summary of how meiosis happens. So at the beginning, all of the chromosomes are first duplicated. And then each of the 46 chromosomes do actually consist two chromatids connected by a centromere. And the process of the chromosomes aligning in pairs is what we call now the synapses. So when a part of the chromatid actually breaks off from its partner and is joining the other pair of chromosome, it then allows the exchange of genetic material, and we call that crossing over. So in meiosis 1, it produces two cells, each having 23 chromosomes composed of two chromatids joined at the centromere. And as we all know, there's another there's a continuation after meiosis 1, we call it the meiosis 2, wherein each of the two cells that has been produced during meiosis 1 is divided then again in two, so giving or showing off four cells having 23 chromosomes at the end. Okay, so since the number of chromosomes are reduced during the process of dividing into four cells, the process is actually what we call the reduction division process. Okay, so in here it shows you the summary of how the first meiotic division happens. So this is the part wherein it shows meiosis 1. So you have again the different phases like early prophase 1, you have middle prophase 1, metaphase, anaphase, and then the telophase. So in here you see that the first two cells are actually divided, and then again these two cells would actually be used again for the second meiotic division. So in the second meiotic division, it will undergo again the same process, and then eventually it would give out it would actually give out four identical cells. Okay. So from fertilization to fetus, so when we say fertilization, this is the union of the sperm and the oocyte. So basically, there's what you call, yeah, an intercourse that should happen between a male and a female to be able to have their sperm and egg unite. So that's what you call the fertilization process. And then, of course, the zygote is actually what's being developed after fertilization happens. So it actually develops into an embryo 3 to 14 days after the fertilization happens. So when you say an embryo, it's around at the age of 14 to 56 days after fertilization, and you would call it a fetus after 56 days from the fertilization. Okay, so in this image that you see on the right, it shows you here how the fertilization happens. So in this one, when the sperm and the egg unites, of course, it would eventually divide into different type or different divisions of cell. Okay, until it produces now your embryo, and eventually when it grows, it becomes a fetus. So to start off, learning more about the reproductive system, let me talk about first the male reproductive system. So the male reproductive system consists of the testes, a series of ducts, accessory glands, and supporting structures. So the ducts include the epididymis, the ductus deferens, and then the urethra. And then for the accessory glands, it includes your seminal vesicles, the prostate gland, and the bulbourethral glands. So for the other supporting structures, it includes your scrotum and of course the penis. So in the image that you see here on your screen right now, this is actually an image, okay, a schematic diagram showing the different parts of the male reproductive system, and of course comparing it with a real um, human anatomy of the male reproductive system. Okay. So for the functions of the male reproductive system, again, of course, this is responsible for the production of the sperm cells. Actually, the process of this production is what we call spermatogenesis. And for the production of the sex male hormones, we have what you call the gonadotropin releasing hormone, or the GnRH. You also have the follicle stimulating hormone, or FSH. You also have the luteinizing hormone, or LH, and then the testosterone. And of course, the transfer of sperm cells to the female is again what we call your fertilization. In the male reproductive organs, first let's start with what you call your scrotum. So it actually contains your testes inside. It contains what you call now your dartos muscle. So this dartos muscle actually moves the scrotum and the testis close to and away from the body depending on the temperature. So basically, it draws your scrotum and your testis towards your body, especially when it's cold. But if it's medyo humid or if it's hot, of course, lumalayo itong inyong mga testis and scrotum away from your body. So the sperm must develop actually at the temperature less than the body temperature. So it would actually require parang a more a cooler temperature for it to be able to or for the male reproductive system to reproduce your sperm. Okay, so in here, as you see, as we dissect the deeper tissues of your of the scrotum, of course, you will see here also the different lymphatic vessels, autonomic nerves, and of course the testicular artery that innervates your testicles. Okay. Next, we have the testis. So this is the primary male reproductive organ. So it produces the sperm in the scrotum, and then it contains what you call now your seminiferous tubules. So it is where the sperm is produced, and it also contains your interstitial cells. So the interstitial cells secrete the testosterone. It also has germ layers or germ cells. These are the cells where the sperm cells arise from. And then it also contains what you call your sustentacular cells, which actually nourishes the germ cells and they also produce what you call the hormones. Okay. So next we also have your epididymis. So this is a thread-like tubules on each side of the testes, and this is where the seminiferous tubules empty the new sperm. So coming from the seminiferous tubules, it will eventually pass on the retitestis, and then of course you to your efferent ductus, and then your epididymis. And then it is also where the sperm continue to mature, develop the ability to swim and to bind with your oocytes. And then you also have your ductus deferens or vas deferens as others call it. It extends from the epididymis and joins to the seminal vesicle, and it is actually the one being cut during vasectomy. So in vasectomy, this is actually a type of contraception or a surgical procedure that is being made for males for them to be able to become sterile. So when you say sterile, this is the inability to produce or to act on something to be able to conceive or to be able to produce an offspring. Okay, so that's what vasectomy is. So again, remember that the sperms or the sperm cells are actually made in the seminiferous tubules, but then the maturity of these cells do actually happen in the epididymis part of your male reproductive system. Okay, so this is actually what's being done during vasectomy. So you have the ductus deferens within the spermatic cord, and then once they open the spermatic cord, the ductus deferens or the vas deferens is cut and tied. So once this happens, of course, the flow or the pathway of the sperm cell will no longer be or can no longer be continued, no, going to the penis. So, yung mga sperm, magiging stuck na lang siya dun sa pinaka last part of the ductus deferens wherein dun nagkaroon ng cut. Okay? So, next we have what you call your urethra. So, this extends from the urinary bladder to the end of the penis. And this is the passageway for the urine and male reproductive fluids. But then again, this urine and of course the reproductive fluids do not come out from the urethra at the same time. So, pwedeng may maunang isa, pwedeng mahuli yung isa. Okay? And then here you also see the penis. This is actually made with the corpus cavernosum, corpus spongiosum, and the spongy urethra. These are the three columns of the erectile tissue which fill with blood for erection. And this is also responsible for the transfer of sperm to, from male to female. And this is the one responsible also for the excretion of the urine. Okay, so once erection happens, of course, this corpus cavernosum, spongiosum, and the spongy urethra are the ones being flushed with blood for the penis to erect. Okay, so in here in this picture, you will see that this is the corpora cavernosa, and then this is the corpus cavernosum. Okay, and then you have here the urethra. So you also have there your different innervating nerves and arteries. Okay. So in this image, it would actually show you the frontal section showing the structures of the penis. So coming from the ureter, you have here your urinary bladder. And then it is here that you see that the ductus deferens. Behind your bladder is actually your seminal gland. It actually passes from the trigone going to the opening of the ejaculatory duct. Behind it is the prostate gland. It will also pass the prostatic urethra. And then here you see that you have the bulbourethral glands. and then it would show you the bulb of penis here at the sides, and then going to the opening of the bulbourethral gland. In here, lateral to the opening of the bulbourethral gland, it would show you the corpus spongiosum. Outer part would be the corpus cavernosum. And then here at the frontal part would be your spongy urethra. And then these parts are the glands. You also have the prepuce or the skin here, and then the external urethral orifice. So if you cut at the cross-section part of your penis, it would actually show you this one. So this is also showing a histological comparison. Okay, if you check on the penis under a microscope, it would actually show you this image, or you should observe this image. So here you see that this is the corpora cavernosa. And then you have there the deep artery of the penis. You also see here your spongy urethra, and then the corpus spongiosum. Okay? So you also see here the dorsal artery in red, the vein in blue, and the yellow is the nerve. So here it shows you a flaccid, or the lateral view of a flaccid penis. So you see here that this is the corpora cavernosa. These are the arteries. You have the spongy urethra at the bottom, and then the prepuce, and then the corpus spongiosum. So in this one, as you see that the cavernosal arteries aren't flushed with blood, so it makes the penis flaccid. But if there's already erection that's happening, of course, this part or the cavernosal arteries are flushed with blood. So the cavernosal arteries dilate, engorging corporal tissue with blood. And then, of course, engorging causes corporal tissue to swell, and then erecting the penis. So engorged corporal tissue compresses penile veins and venules, maintaining the erection. Okay. So for the male reproductive system glands, the first one would be a seminal vesicle. So it is actually next to the ductus deferens, and it helps form your ejaculatory duct. You also have your prostate gland, which actually surrounds your urethra, and it is the size of a walnut. But then again, this prostate gland, as we get older, or as males get older, sometimes it causes prostate cancer. Especially if the males do not actually, or don't have regular visits with the doctor. There may be an instance that they may forget, or they may not be aware that they do have prostate cancer. So for the males, um, it is usually recommended that you visit your doctor to check on your prostate gland at the age of your 40s. Okay, so pag mga 40s na, dapat nagpapacheck na ng prostate gland kung okay pa ba siya, or kung hindi kayo nagde-develop ng kahit anong sakit na related sa inyong prostate gland. And then you also have your bulbourethral gland, which is a small mucus secreting gland near the base of your prostate gland. So in here, it shows you the medial view of the male reproductive system. So in here, you see the seminal vesicle at the back of the urinary bladder. And then below, you would show, it would go directly to the prostate gland. Okay, and then the bulbourethral gland is here. This one shows you again an anterior view of how the male reproductive system looks like, and then this is the ventral surface of, again, the penis. Okay. So for the secretions, for males, you have what you call your semen. Okay, so this is a mixture of sperm and secretion from glands. It provides a transport medium and nutrients that protect and activate the sperm. So 60% of the fluid is from the seminal vesicles, 30% of the fluid from the prostate gland, 5% from the bulbourethral glands, and 5% from the testes. So that's actually how the mixture of the semen is composed of. Okay? So for the secretions, of course, there would always be differences, okay, depending on from the part where it was secreted. So first, let's tackle the seminal vesicles. So with the seminal vesicles, they actually provide fructose. So fructose is a type of sugar, and it contains what you call the prostaglandins, which decrease mucus thickness around the cervix and uterine tubes and help sperm move through the female reproductive tract. Okay, so again, with fructose and sugar, of course, the sperm do need a lot of energy. Okay, so with this fructose, it gives energy to the sperm to be able to have a successful journey going to the egg cell. So it also contains coagulants that help to deliver the semen into the female. Okay, and then next you have the prostate gland. It contains enzymes to liquefy semen after it is inside the female and neutralizes the acidity of the vagina. Again, the vagina is something, it's actually very acidic. So if the vagina continues to be acidic, of course, most of the semen or most of the sperm cells that would be sent to her or to a female would actually die. So without these enzymes or without these secretions from the prostate gland, of course, the pH of the vagina wouldn't be neutralized. And then next, you have the mucus or the secretions from the bulbourethral gland, which is also responsible in neutralizing the acidity of the male urethra and the female vagina. Okay, so again, with the male urethra, remember that it is also the pathway where the urine flows or goes out from or from the body of a male. So if, of course, the acidity of the urine remains on the urethra, of course, when the sperm do pass from the urethra, it would eventually die as well. Without this mucus, of course, it wouldn't, or the sperm wouldn't be having a successful path or journey along the urethra. Okay? So testicular secretions actually include sperm and small amounts of fluid. So 2 to 5 ml of semen is ejaculated each time. And 1 ml of the semen contains around 100 million sperm already. So sperm can be live for 72 hours once inside the female. So in here, kailangan within 72 hours ma-reach ng isang sperm yung egg. Kaya nga 'di ba nga kapag sinasabi when it comes to fertilization, it's actually a battle of the fittest. So if you would really like to have a successful fertilization with a woman, dapat yung quality of sperm ng isang male ay maganda. Kaya nga meron ng mga interventions ngayon na wherein couples do actually tend to visit OB-GYNs to be able to check whether the quality of the sperm or the egg is okay for fertilization. So, if in any case that there would be parang problems with the quality or quantity of the sperm, lalo na sa mga lalaki, of course, they would need to undergo medication, no, para ma-boost yung number of sperm na pwedeng i-produce ng isang lalaki, and of course, to have its quality improved as well. Okay? Kasi there are some instances that male, especially kapag overwork, okay, stressed, no? Isa yun sa mga factors actually na nakakaapekto when it comes to the production of your sex cells. Even the choice of lifestyle, like kung mahilig kang uminom, mahilig kang magyosi, meron kang ibang bisyo, nagkakaroon talaga ng problema dun sa production ng inyong sex cells. Okay? So for the path of the sperm, so this is the way how the sperm goes out of the body of a male. So again, the sperm develops in the seminiferous tubules of the testes, and then going to the epididymis, where this is actually the site of where the sperm matures, and then going to the ductus deferens, and then it receives secretions from the seminal vesicles, prostate gland, and the bulbourethral gland. And then the urethra, this is where the semen or the sperm exits the body, and then eventually to the penis. Okay, so the image that you see here on the right side is just an example of how you could actually memorize the sperm pathway. But this 7-up is not actually complete. Okay, so it would just give you like a simple or an easier way of memorizing how the sperm pathway looks like. But then again, remember that after the seminiferous tubules, you still have what you call your retetestes, and then you have your efferent ductules before reaching the epididymis, and then going to the ductus deferens, and then the urethra, and then the penis. So please go back to the different images or the structure of the testis and this of the testis in your book and from this presentation for you to be able to map out how the sperm comes out from the seminiferous tubules going to the penis. Okay? So again, spermatogenesis is the formation of the sperm cells, and it actually begins at puberty. Okay, so with the development of the sperm, usually nare-reach ng mga males yan during the puberty years. So you have the interstitial cells from the seminiferous tubules, which increases in number and in size, and then the seminiferous tubules do enlarge, and they produce germ cells and sustentacular cells. So for the production of the sperm cells, again, we have spermatogenesis. So from the germ cells, as we all know, germ cells, these are the kumbaga, primitive type of cells or original cells where cells do arise from them. Okay? So it would eventually develop into a spermatogonia, and then to a primary spermatocyte, to a secondary spermatocyte, being going to a spermatid, and then eventually to a mature sperm cell. Okay? So from a spermatogonium, which is the germ cell, that's what actually we call them, it will undergo mitotic division, produce a daughter cell, and then produce a primary spermatocyte. In the first meiotic division, it would produce 2 secondary spermatocytes, and then undergoing secondary meiotic division, it would produce 4 spermatids. So the spermatids will then develop and then become sperm cells in the lumen of the seminiferous tubules. Okay? So for the sperm cell structures, so once this spermatocytes or spermatids do develop, they would eventually have a head, which actually contains a nucleus and the DNA. It will have a meat piece, which contains the mitochondria. So this is where they get their energy. And then, of course, the flagella or the tail for their movement. Okay? In this image, you will see here that this is actually how the spermatogonia looks like. So if this is the basement membrane, um, closer to it is actually the spermatogonia, and then primary and secondary spermatocytes in the middle, and then eventually the presence of the tail or the flagellum would already give you an idea that it's already developing into a spermatid, and then eventually to a mature stem cells. So you see that there's also Sertoli cells and interstitial cells or Leydig cells that do support the growth of these sperm cells. Okay? So, at the head, okay, of your sperm, it actually has an acrosome. So, this acrosome do have enzymes that do have the capability of penetrating the egg. Okay? So, meron niyang nire-release na enzyme para ma-break niya yung wall naman ng egg. Okay? So, for the male sex hormones, again, we have the gonadotropin-releasing hormones. It is from the hypothalamus. The target tissue is your anterior pituitary. And then it stimulates the secretion of your luteinizing and follicle-stimulating hormones. You also have the luteinizing hormone from the anterior pituitary. It targets your interstitial cells of the testes and stimulates the synthesis and secretion of the testosterone. For the follicle-stimulating hormones coming from the anterior pituitary, it targets the seminiferous tubules, especially the sustentacular cells, and supports spermatogenesis and inhibin secretion. For the testosterone, its source is actually the Leydig cells or the interstitial cells of the testes, and it targets the testes and body tissues for the development and maintenance of reproductive organs, supports spermatogenesis and development of secondary characteristics. So when you say secondary characteristics in males, ito yung pagkakaroon ng hair sa armpits, pagkakaroon ng Adam's apple, having lower voice. Okay, yun yung mga tinatawag nating mga secondary characteristics. And then another target tissue of the testosterone would be the anterior pituitary and hypothalamus that inhibits gonadotropin-releasing hormone, luteinizing hormone, and follicle-stimulating hormone secretion through negative feedback. And then inhibin, the source is your sustentacular cells. It attacks your anterior pituitary to inhibit follicle-stimulating secretion through negative feedback. So in here, it shows you how the regulation of the reproductive hormone secretion in male happens. So in here, the gonadotropin-releasing hormone from the hypothalamus stimulates the secretion of the luteinizing hormone and follicle-stimulating hormone from your anterior pituitary. So again, with a green arrow, it shows you that it's stimulatory, and if it's red, it's inhibitory. So once it stimulates the release of LH and FSH, of course, the interstitial cells of the testes do produce testosterone, and then the sustentacular cells of the seminiferous tubules also plays a role when it comes to spermatogenesis. So with the testosterone, it also gives support to the sustentacular cells and, of course, the development of the sex organs and secondary characteristics. So when there's too much testosterone, it also inhibits the GnRH, okay, and of course the release of the LH and FSH. Even with the sustentacular cells of the seminiferous tubules, it also gives inhibitory effect on the LH and FSH release. Okay? So for male puberty, it is actually a sequence of events in which a boy begins to produce male hormones and sperm cells. So please take note that the development of the sperm do actually happen during the puberty years in a male. Okay? So later on, I will be telling you why you should remember when this progress or this growth happens in male. Okay? So it begins at 12 to 14 and ends around 18 years old. So the testosterone is the major male hormone, and secondary characteristics that can be developed could be skin texture, fat distribution, hair growth, skeletal muscle growth, and larynx changes. So for the male sex act, so the male sex act is a complex series of reflexes that result in erection of the penis, secretion of mucus into the urethra, emission, and ejaculation. So when you say emission, this is the movement of sperm cells, mucus, prostatic secretions, and seminal vesicle secretions into the prostatic, membranous, and your spongy urethra. For ejaculation, this is the forceful expulsion of the secretions that have accumulated in the urethra to the exterior. And then, sensations, normally interpreted as pleasurable, occur during the male sex act and result in an intense sensation called an orgasm. So, a phase called resolution occurs after ejaculation in which the penis becomes flaccid. An overall feeling of satisfaction exists and the male is unable to achieve erection and a second ejaculation. Okay? So, again, with males, guys, kapag ka nagkakaroon ng intercourse, okay, kapag ka ang guy or ang lalaki, na-reach niya na yung epitome or yung orgasm phase niya, maniwala kayo na hindi na ulit siya magiging erected after. Okay? It would actually take time for it to, kumbaga, re-energize para mag-erect ulit siya. Okay? So, I think that or I'm not really sure about this one, but yun nga, minsan nagiging tampulan nga ng tukso yan among boys. No? Yung mga tinatawag nilang mga patagalan. Okay? Up until, kung kumbaga hanggang kailan nila kayang pigilan yung pagkakaroon nila ng or pagre-release nila ng orgasm. Kasi once na na-release na yung orgasm na yun, yung erection mawawala and magiging flaccid na ulit yung penis. Okay? So, kumbaga may hangganan, okay, yung ganong sensation or intense sensation ng isang lalaki. Pag na-reach na yung orgasm period, okay na, andun na yun, magkakaroon na siya ng resolution. Okay, and it would take time again para magkaroon ulit ng or reignition ng emission and ejaculation again for the males. Okay, which is very different naman from the female. So, later you would know about it. So, for the penile erection is actually the first major component of the male sex act. So, neural stimuli causes the penis to enlarge and become firm, and specifically, parasympathetic action potentials from the sacral region of the spinal cord cause the arteries that supply blood to the erectile tissues to dilate. And then, when the blood then fills small venous sinuses called sinusoids in the erectile tissue and compresses the veins, which reduces blood flow from the penis. So, ejaculation results from the contraction of smooth muscles in the wall of the urethra and skeletal muscles surrounding the base of the penis. So, just before ejaculation, action potentials are sent to the skeletal muscles that surround the base of the penis. And then rhythmic contractions are produced that force the semen out of the urethra, resulting in ejaculation. In addition, muscle tension increases throughout the body. Okay, so before we move on to the female reproductive system, I would just like to remind that with guys, okay, yung cavernosome, yung three erectile tissues, okay, ng penis, okay? Kasi 'di ba, usually nagiging ang tawag yata nila sa mga erection na maganin ay mga boner, tama? Okay? So guys, ang i-clarify ko lang that the penis isn't really a bone. Okay? So, that isn't really made up of bone. Okay? It's made up of tissues that do erect when there's a flush or there's a swoosh of amount of blood. Okay? So, kapag yan guys, nabali, okay, lalo na kapag you're getting too excited when it comes to intercourse, dapat mag-iingat, no? Parang ano lang din to, parang kumbaga sex education, okay? Kapag kasi yung mga muscles or tissues na yan from in the penis nag-break or na-broke, okay? Hindi nyo na may babalik yan sa dati. Okay? So, yung mga, alam nyo naman, alam ko na alam nyo na merong mga experiments na ginagawa when it comes to the intercourse process na, no? Kapag yung kumbaga, yung libido na tinatawag nila ay nasa rurok na. Okay? Minsan nakakalimutan na may hangganan. Okay? Please remember that there's always, kumbaga, merong limit, okay, yung mga kayang gawin ng katawan natin. Hindi dapat sila pinupush ng sobra-sobra kasi nga, yun. For males, kapag nabali na yan, wala na. Okay, kahit anong gawin mo dyan, hindi na pwedeng bumalik sa dati yung sensation and even yung pag-erect ng penis kapag nabali na. Okay, so dapat laging mag-iingat. Okay, hindi siya bone, it's just a tissue, but then again kapag yun nga, nagkaroon na ng problema dun sa tissues na yun, and even of course, the blood flow, okay, magkakaroon talaga ng problema, and then magkakaroon na kayo ng erectile dysfunction. Okay, so let's move now with the female reproductive system. So this is now composed of the ovaries, the uterine tubes and the uterus, the vagina, the external genitalia, and the mammary glands. So in the internal reproductive organs of the female, it is located in the pelvis between the urinary bladder and the rectum. So in here, you see the lateral view of the female reproductive system and of course the external parts of the female reproductive system. So let's get into these parts. So in the female pelvis, you see here the medial view. You see here the uterine tube, your ovary. You have the uterus here. This is actually anterior to your to the large intestine, no? To the end of your large intestine. So sa harap ng uterus is your urinary bladder. You have here your urethra. This is the pubic symphysis. You have your clitoris here, the vaginal orifice, the labia minora, and then the labia majora. Okay? So, if you think of it, di ba nga sa mga buntis, bakit ba lagi silang ihi ng ihi? So, here kasi di ba the uterus, dito nag-stay ang baby. Okay? So, ang nangyayari dyan kapag mabigat yung uterus na yan, nape-press down niya yung urinary bladder. Kaya ang mga buntis, lagi silang mahilig umihi from time to time. Okay? Kasi nako-compress yung urinary bladder nila. Okay? So, that's how the position of the female reproductive organs do look like in a medial view. And then this one, okay, this is the anterior view of the female reproductive organs. So in here, you see that the different parts, okay, of your uterus. So here you have the fundus. So if this is the uterus, it has a fundus, the body, and the cervix part. And then this one is what you call the broad ligament that suspends the fallopian tubes or the uterine tubes to the cervix. And then you also have here the uterine cavity. If you open this up, it would show you here naman the fimbria, wherein the ovary opens to it, and then the suspensory ligament that suspends the fallopian tube, and then the ampulla of the uterine tube itself to the uterine cavity. You also have the ovarian ligament, the round ligament, and then you have the different layers of your uterus. You have endometrium, of course, the one that's in the inner part. You have the myometrium or the muscular layer, and then the perimetrium, which is the serous layer. And then you also have here your broad ligament. And then this part is your vagina. It shows you here the cervical canal and then the opening of the cervix. Okay? So the functions of the female reproductive system again is actually to produce female oocytes or the female sex cells under the process of what we call oogenesis. So in here, the female sex hormones being released are GnRH, or the gonadotropin-releasing hormone. You also have the luteinizing hormone, the follicle-stimulating hormone. So special for females are the estrogen, progesterone, and then oxytocin, and of course the human chorionic gonadotropin. So in this one, the oxytocin and human chorionic gonadotropin are actually very, kumbaga, very present, okay, during pregnancy. Okay? And then of course they receive sperm from the males and they develop and nourish the embryos. So for the female reproductive organs, again, the ovaries are the primary female reproductive organ and they produce oocytes and sex hormones. So they are found one on either side of the uterus. So bilateral sila, dalawa. They have the ovarian ligaments which anchor the ovaries to the uterus. And then you also have the suspensory ligaments that anchor the ovaries to the pelvic cavity, and then the ovarian follicle, which is the cell in the ovaries that contain the oocytes. Okay, so you also have the utero-ovarian ligament, which suspends the ovary to your uterus. And then, of course, a broad ligament here. So the structure of the ovary and the ovarian follicles, if we go back again to the lectures before, you already know this one that we have here the Graafian follicles. You have the different zone like the zona pellucida, the theca, the vesicles. You also have here the degenerated corpus luteum, especially when ovulation has already been done. Okay, so this is where the egg cells do actually develop. Okay, so you also have for the other organs the uterine or the fallopian tubes, which is the part of the uterus which extends towards the ovaries to receive and receive the oocytes. And then it has a fimbriae. So with the fimbriae, this is a fringe-like structure around the opening of the uterine tubes that helps sweep the oocytes and then into sending it to the uterine tubes. And then this is also where the tubal ligation happens. So if there is vasectomy for males, for females naman, it's what you call the tubal ligation. So this is the sterilization process for the females. So um, one clinical application as well that or clinical um, case that you could also um, link to your fallopian tubes or what you call the ectopic pregnancies. So if the fertilized oocyte or zygote implants somewhere besides the uterus, usually kumbaga hindi na embed sa tamang lugar yung oocyte, nagkakaroon tayo ng tinatawag na ectopic pregnancy. And this ectopic pregnancy usually happens sa part ng fallopian tube or the uterine tubes. Okay, so imbes na sa uterus nagkakaroon or nai-embed yung pinaka-oocyte after fertilization, ang nangyayari, nai-stagnant sila dun sa side ng uterine tubes. Okay, so again, this uterine tube is not viable to hold yung size ng isang baby or a growing fetus. Kaya nagkakaroon tayo ng tinatawag na ectopic pregnancy. Sa ectopic pregnancy, marami dyan, usually nalalaglag ang baby. Okay? Or hindi nagiging successful ang pregnancy. But there are ways now, because of the development of technology, that ectopic pregnancy can be succeeded. Okay? So from there, pwede nilang, kumbaga, ilipat papunta sa uterus yung growing na fetus. Okay? So this is actually how tubal ligation happens in females. So if this is the uterine tube, it is being cut and it's also being tied. Okay, so again, kapag tied na siya, of course, the flow of the oocyte will no longer be successful going to your uterine tube and then eventually to the uterus. So this is actually how sterilization happens in females. So this sterilization or ligation is not usually recommended for young moms or yung mga bata pang nanganganak, like mga 23 or hanggang kahit mag-30, hindi talaga siya usually nire-recommend kasi nga bata pa for that age, no? Marami pang pwedeng gawin si ovaries para sa isang babae dun sa mga years na ganun. Okay? But if the parent is already, or the woman is already siguro nandun na sa age talaga na alam natin na ang pregnancy is no longer parang viable for their age, di ba nga, kapag ang mga babae nag-age na din, there's always a risk, okay, kapag ka nagkakaroon or pagka na-impregnate ang isang babae. Okay, kasi hindi na nga nagiging viable yung parts ng reproductive system nila to be able to have a successful pregnancy. So, usually at the age of 36 to 38 hanggang 40, minsan mga delikadong ages na yan para magbuntis ang isang babae. Okay? So, hanggat maaari, ang ligation, ginagawa siya sa later years, but then again, kapag dating naman sa tinatawag nating mga family planning, okay, yung vasectomy, yung mga ligation na yan, they are actually just options. Okay? But then again nga, sa mga babae, hindi talaga recommended na at an early age, magpapaligate ka na. Kasi sayang naman yung mga hormones na nare-release ng ating ovaries and then hindi mo na siya mapapakinabangan once na pinaligate mo na yon. Okay, so usually din naman kasi ligation or vasectomy is being done to support also yung kumbaga kakayanan ng isang couple to have children. Okay, so but then again, this ligation and vasectomy usually they do also face issues, no, when it comes to yung mga family planning na ganyan. Okay, but of course, these processes or these surgeries are of course of choice, depending dun sa kakayanan ng isang couple. Okay? So for the other organs, you also have your uterus. This is a pear-sized structure located in the pelvic cavity. So it is to receive, retain, and provide nourishment for the fertilized oocyte where the embryo resides and develops. So the body, this is the main part, and then you have the cervix part. This is the narrow region that leads to the vagina. So again, the uterus has different layers. The serous layer is the perimetrium, which is the outermost layer, the myometrium or the muscular layer, and then the endometrium, which is the innermost layer that is sloughed off during menstruation. So yeah, dyan naman ang menstruation naman kasi once that an egg is not fertilized, no, dumidikit lang yung or nagmamature lang yung egg cell dun sa walls of the endometrium. And then eventually, kapag kailangan ng i-shed off ng isang babae, sumasama na yon. Okay? So it's always the endometrium that's being sloughed off during menstruation. So then again, we also have the vagina. This extends from the uterus to the outside of the body. And then this is the female copulatory organ that receives the penis during your intercourse. So it also allows menstrual flow. It's also involved in childbirth. It contains very muscular walls and mucous membrane, and it is very acidic to keep the bacteria out. Okay? So for the external female genitalia, we have the vulva. So the vulva is the external female sex organs. It contains the mons pubis, labia majora, minora, and then the clitoris and the vestibule. So in here, the mons pubis is actually the fatty layer of the skin covering the pubic symphysis. You have the labia majora. Okay, the labia majora is the larger outer folds of the skin, equivalent to the male scrotum. And then the labia minora here, which is the thin inner folds of the skin. Okay. So you also have here the clitoris. So this is the small erectile structure located in the vestibule. It is equivalent now to the male penis. So more of the sensation dyan sa clitoris. And then you also have the prepuce where the two labia minora unite over the clitoris. So even in males, they do have the prepuce. Okay? And then of course the vestibule So this is the space in which the vagina and the urethra are located. And then you have the pudendal cleft, and of course the clinical perineum. Ito yung kinakat, okay, kapag nag-childbirth. Kunyari hindi kasya yung, or masyadong masikip yung puwerta ni mommy, ito yung kinakat nila ng kaunti. And then tinatahi din nila pabalik pagkatapos ng mga nakang isang babae. Okay? Then here again, this is the medial view. So I have already discussed this one. And then for the follicle and oocyte development. So in fetus, ito guys, ito yung sinasabi ko sa inyo that if the males do actually produce sperm during the puberty years, ang mga females naman from the start that na-fertilize or nabuo tayo sa sinapupunan ng nanay natin, meron na tayong mga nakabangko na egg cells. Okay? Kaya nga merong menopause kasi nauubos yung mga egg cells na yan. So, kumbaga may hangganan. Ang lalaki kasi, ang sperm cell nila, hanggat tumanda sila, meron sila niyan. Okay? Kayang-kaya nilang mag-produce ng sperm anytime. From puberty hanggang mamatay sila. Ang kaso lang, of course, kapag ka nag-age ang isang lalaki, the quality of the sperm also decreases. And or even the quantity. Okay? Sa mga babae naman, kahit bagong panganak pa lang ang babae, okay, meron na tayong kumbaga nakabangko ng mga egg sa atin. And then, ma-activate na lang siya kapag dumating na rin tayo ng puberty years. So, sa puberty years na yon, kung ilan yung marirelease natin hanggang mag-menopause tayo, yun yung number of egg cells na meron tayo sa katawan. Yun yung sa mga babae. Kumbaga may definite number lang. Okay? So, yun nga, parang per month, meron tayong isa dapat na lumalabas na egg cell. Okay? Na pagka hindi na fertilize, it would go out through menstruation. Okay? Kaya nga dito nakita nyo, fetus pa lang, meron ng oogonium. Samantalang ang spermatogonium ng mga males, nagde-develop pa lang siya kapag puberty years na nila. Okay? So, sa fetus, for the oocyte, you have the oogonium. It is found in the primordial follicle. And then, meron na ring primary oocyte. So, they are arrested. Kung baga yung development of this oocytes or egg cells are arrested. Kumbaga merong part doon sa meiosis na nakastop. Okay? And then magtutuloy na lang siya ulit kapag nasa puberty years na. Okay? And then pag puberty to menopause, of course the primary oocyte nasa primary follicle, primary oocyte moving to the secondary follicle, and then primary oocyte and secondary oocyte going to the mature follicle. Okay? So again, in this one, it shows you the maturation of the oocytes and the follicle. So in this one, before birth, meron ng oogonia, okay, and then the first meiotic division, and then meron ng primary oocyte and primordial in the primordial follicle. Tapos from birth to puberty, usually merong mga primary oocytes that decrease to around 300,000. So, marami-rami din tayong mga naiibang sa mga babae na nababangkong egg cells. Okay? And then, from puberty to menopause, ayan na. Of course, the primary follicles will then, or the primary oocytes will then develop into the primary follicles, secondary follicles, and then mature follicles. And then, during ovulation, ayan, secondary oocytes siya. And then eventually the follicles will become corpus luteum and then corpus albicans. Okay? So dito tignan nyo, kung makikita nyo dito sa puberty to menopause, kung nag-stop ang meiosis 1 from birth to puberty, yung puberty naman to menopause, tsaka lang na itutuloy yung susunod na division of the meiotic or the meiosis process. Okay? So ganyan yung nangyayari sa arresting of the progress of the growth of egg cells up to its maturation. So for the ovulation, this is when a mature follicle ruptures, forcing oocyte into the peritoneal or the pelvic cavity due to the luteinizing hormone that is secreted by the anterior pituitary gland. Okay, so the corpus luteum is a mature follicle after the ovulation and degenerates if the egg is not fertilized. So it will then become a corpus albicans. Kasi kapag ka ang egg na fertilize, it will become a zygote. Okay? So, other female reproductive facts. So, females are born with all of their oogonia, around 2 million. So, mayaman-yaman tayo. So, hindi nga lang sa pera, pero sa oogonia. So, unlike males that only begin to produce sperm during puberty. So, at puberty, about 300 to 400,000 oogonia are left. So, majority of the oogonia are hindi na nagtutuloy. Okay? So, puberty to menopause, FSH, simulates several follicles to begin developing during each menstrual cycle, but only one follicle should be ovulated. So, regulated ang pag-release ng egg cells. So oocytes are swept into one of the uterine tubes by the fimbriae, and if sperm is present in the uterine tube during ovulation, oocyte could be fertilized. If fertilization occurs, then zygote implants in the uterus, and the oocyte only lives for 24 hours. So if no sperm is present at ovulation, no zygote develops and the oocyte dies. Okay? So for female puberty, it begins between 11 to 13 years old and is usually completed by at the age of 16. So menarche is the first episode of the menstrual bleeding. Usually for females, kung nagkaroon na ng menarche, medyo dark colored. Okay, itong menarche na to. And then vagina, uterus, uterine tubes, and external genitalia to enlarge, and fat is deposited in the breast and the hips. Okay? And then elevated levels of estrogen and progesterone are secreted by the ovaries. Okay? So, yung mga females, okay, na medyo sa tingin nyo napapaghulihan na kayo when it comes to size of the breast and kung ano pang ibang secondary characteristics na wala sa inyo, it's okay. Okay? It may be because of the hormones. It may also be because of your genes. Okay? Hindi nyo dapat ikahiya if you have a flat breast. If hindi maganda yung butt ninyo. Okay? Kung hindi bootylicious, it's okay. Yung mga, usually kasi minsan may ibang mga ladies na late bloomers. Okay? Hindi nawawala yung mga ganun. Meron talagang mga ganun. Okay? But it doesn't necessarily mean na kapag ka, hay nako, 16 years old na ako, pero bakit flat-chested pa rin ako? Hindi ibig sabihin na abnormal ka na. Okay? Meron lang talaga minsan delayed yung growth and maturity. Okay? Depending on the release of the hormones. Sabi ko nga, and of course, yung mga lifestyle. Okay? Meron ding genetics. Okay? So, yun. And then, mammary glands. So, this is the organ for the milk production in the breast. So, this is actually a modified type of sweat gland. So, the female breasts begin to enlarge during puberty. It consists of lobes covered by adipose. And lobes, ducts, lobules are altered during lactation to expel the milk. Okay, so in this one, it would show you the lactiferous ducts. It has alveoli at the end. So, at the ends, you have lobules. So, etong kabuuan na to, it's called a lobe. Okay? So, sa breast, this one, makikita nyo na may mga adipose tissue, kaya medyo malambot-lambot yan. You also have the lactiferous ducts here. Kapag ka non-lactating breast, guys, kung i-compare nyo, medyo mas maliit siya sa mga lactating breast. Kasi sa mga lactating breast, yung mga lobules nila, marami silang milk. Okay? Compared to the non-lactating breast. So, the areola, ito yung tinatawag na yung parang encircled, dark circled part ng inyong breast. And then, the nipple, yung nasa pinakagitna. Okay? And then again, the lobules and then the lobes. Ayan. So, comparing ang epithelium ng non-lactating, ganyan lang siya. Pero kapag lactating ka, yung mga lobules na yun ay lumalaki because of the milk. Okay? So that's how the mammary glands look like. So this is not only true to females, okay? Sa mga males, meron din ganito. Okay? If you have watched or have read news na merong mga ibang lalaki nga na multiple pa yung mammary gland or yung mammary glands nila, 'di ba? Merong mga pinapanganak na marami yung nipples. Possible yon. It may be because of genetics. Meron din naman na lalaki pero parang yung mammary glands nila ay pambabae. Okay? Pwedeng deposition of fat yon, pwedeng genetics pa rin. Okay? So, depende pa rin kung ano yung mga magiging, kumbaga, main reasons on why certain persons do have yung structure ng glands nila or mammary glands nila ay ganun. Okay? So, for the female sex hormones, you have again the gonadotropin-releasing hormone. The source is the hypothalamus. Target tissue is the anterior pituitary and stimulates the secretion of LH and FSH. For LH, its source is the anterior pituitary. It targets your ovaries, which causes the follicles to mature and undergo ovulation, cause ovulation and ovulated follicles to corpus luteum. For FSH, the source is anterior pituitary. Target tissue is the ovaries and causes the follicles to begin development. And then for estrogen, the source is the follicle of the ovaries and the corpus luteum. The target tissues are the uterus for the proliferation of endometrial cells, the breast for the development of mammary glands, especially the ductal systems. It also targets the anterior pituitary and hypothalamus for positive feedback before ovulation, resulting in increased LH and FSH secretion, negative feedback with progesterone on the hypothalamus and anterior pituitary after ovulation, resulting in decreased LH and FSH secretion. For other tissues, this is for the development and maintenance of the secondary sexual characteristics. You also have the progesterone. It's coming from the corpus luteum of the ovaries. So target tissues are the uterus, the breast, anterior pituitary, and other tissues as well. And then you have the oxytocin, which is from the posterior pituitary. It targets the uterus and mammary glands. It's for the contraction of your uterine smooth muscle and contraction of cells in the breast, resulting in milk letdown in lactating women. So it's very important that there's enough oxytocin in lactating women or yung mga bagong panganak na babae para magkaroon sila ng milk letdown. Pero there are also some instances that women don't really have the capability of producing milk. Okay? Maybe it's because of the hormones as well. Okay? Minsan, if you watch mga news or if you're part of organizations wherein meron kayong kapatid siguro na mother na or kamag-anak na mother na and then nagkakaroon sila ng problema sa milk letdown, usually they talk about it and nagkakaroon sila ng milk bank na tinatawag. So some mothers do actually donate their milk, lalo na yung talagang maraming napoproduce para makatulong sa ibang mothers na hindi kayang mag-produce ng mga milk. Okay? And then, the human chorionic gonadotrophin. So, the source is the placenta, and the target tissue is the corpus luteum of the ovaries. So, it maintains the corpus luteum and increases its rate of progesterone secretion during the first one-third or first trimester of pregnancy, and increases the testosterone production in the testes of the male fetuses. Okay? So, next is the menstrual cycle. This is a series of changes that occur in sexually mature non-pregnant females. So, sa females, we are very, or we know very much about menses. So, this is the time when the endometrium is shed from the uterus. And the average is around 28 days and results from cyclical changes that occur in the endometrium. So, usually, hindi lang talaga siya 28 days, but primarily, the target would be 28 days, minsan more than. Okay? So, for the stages of menstrual cycle, Days 1 to 5, menses is the shedding of the endometrium. So you see their menstrual bleeding, estrogen and progesterone levels are low, and follicle begins to mature. And then day 6 to 13 is the proliferative phase. This is between end of menses and ovulation. So the endometrium rebuilds, estrogen levels begin to increase, progesterone levels remain low, and follicle matures. So for day 14, it is already the ovulation time or the ovulation day. So oocyte is released due to the luteinizing hormone, estrogen levels are high, progesterone levels are increasing, and cervical mucus thins. And then days 15 to 28 is actually the secretory phase between ovulation and the next menses. So the endometrium is preparing for implantation, estrogen levels decrease, progesterone levels are high, and cervical mucus thickens. So in here, it shows you a comparison or a graph wherein what happens with your pituitary gland in the time also of the ovary and of course the uterus. And of course the levels of the estrogen and the progesterone. So in here you have first few days of menses and then the proliferative phase. This is actually how the endometrium looks like. The levels of the progesterone, estrogen, and then the developing follicles, and of course the processes in the pituitary gland. But in the secretory phase, as you see, medyo kumakapal ang endometrium. Tumataas din yung levels of your progesterone. In here naman sa estrogen, medyo mababa na onte. And then ovulation occurs until corpus luteum. And of course, in here, you see that there's already a stimulatory and inhibitory effects of the luteinizing hormone and the follicle stimulating hormones. And then on the last days or the menses, here, this is already the shedding of the endometrium. So it goes back to the original kumbaga thickness of the endometrium. And of course, all else follows. The level of the estrogen, the progesterone, and of course, the levels of the pituitary gland secretions. Okay? So, menopause. So, this is the time when ovaries secrete less hormones and number of follicles in ovaries is low. The menstrual cycle and ovulation are less regular. So in a person who is reaching actually the menopausal stage, they do exhibit hot flushes. They usually feel too much fatigue, irritability may occur. So estrogen replacement therapy may be used to decrease the side effects. So this is actually an inevitable kumbaga phase in a life of a woman. Okay? Talagang marireach natin yung phase na to wherein wala na, mauubos na yung ating mga egg cells. And then, mafe-feel na natin tong mga uncomfortable na mga feeling. Okay? Like fatigue, irritability. Okay? Mapapansin nyo yan sa mga nanay nyo. Sure ako. Okay? Kahit sa mga, medyo yung mga palola age na. Okay? Sila yung mga usual na nakakaranas ng mga ganitong mga effects. So for a menopause, so again, you will have here or you will feel low levels of mood swings, hot flashes, night sweats, decreased libido, irregular periods, and of course, vaginal dryness. Okay? So it's because of the low levels of the estrogen, decreased estrogen production of the ovaries, low levels of testosterone, erratic levels of the estrogen and progesterone, and then of course the thinner vaginal walls. Okay, so those are the different effects of having a menopause. So if there's a male sexual behavior, of course there's a sexual behavior also for females. So sexual drive in females like sexual drive in males is dependent on hormones. So kala nyo ang testosterone ay sa lalaki lang. Pero sa babae, there are testosterone-like hormones and possibly estrogen affect brain cells, especially in the area of the hypothalamus, and influence sexual behavior. So these testosterone-like hormones are produced primarily in the adrenal cortex, and psychological factors also play a role in a female's sexual behavior. So, the sensory and motor neural pathways involved in controlling female sexual responses are similar to those found in the male. So during sexual excitement, erectile tissue within the clitoris and around the vaginal opening becomes engorged with blood. So hindi lang sa male, okay? So there's also the mucous glands within the vestibule secrete small amounts of mucus with larger amounts excreted into the vagina through its walls. And stimulation of the female's genitals during sexual intercourse and psychological stimulation normally trigger an orgasm or a climax. Okay? So the vaginal and uterine smooth muscle as well as the surrounding skeletal muscles contract rhythmically and muscle tension increases throughout much of the body. After the sex act, there is a period of resolution which is characterized by an overall sense of satisfaction and relaxation. But then again, compared to males, kapag yan, sa males nga, di ba sabi ko, pagka na-reach na nila or nakapag-ejaculate na sila, usually nagiging flaccid na ang kanilang penis. Sa babae naman, hindi ganon katagal bago, kumbaga, magkaroon ulit ng urge. Mas mabilis magkaroon ulit ng urge sa babae compared sa mga lalaki. Okay? And then, For contraceptions naman, these are methods used to prevent pregnancy either by preventing fertilization or by preventing implantation of the developing embryo. So again, the methods include behavioral, barrier, chemical, and surgical. Okay, so sa mga behavioral guys, ito talaga yung mga pagtitimpi, pagtitiis, okay? More on, ito-challenge talaga yung sarili mo. Pag mga barrier naman, ito yung mga cups, ito yung mga condoms. Pag chemical naman, ito yung mga iniinom, mga pills. Kapag ka naman surgical, again, it's vasectomy and ligation. Okay? So, maraming ways of contraception. So, for the clinical application or the clinical diseases associated with the male and the female reproductive system, first, we have the pelvic inflammatory disease or PID. This is a bacterial infection of the pelvic organs commonly caused by a vaginal or uterine infection with the bacteria gonorrhea or chlamydia. So early symptoms include increased vaginal discharge and pelvic pain, but antibiotics can cure this inflammatory disease. But if untreated, it can lead to sterility or be life-threatening. Okay, so pwedeng mag-cause ng hindi ka na makakapag-conceive. Okay, and can be fatal, lalo na kapag hindi nyo nararamdaman. Okay, so kung ang mga males, kailangan nilang mga 40 pa lang, no? 40, nagpapacheck na sila ng mga prostate nila. Sa mga females, as early as 35 years old, dapat nagpapacheck na rin sa mga OB/GYN, especially kapag lalo na yung pagpapacheck ng breast, okay? Kailangan mga ganong age, and even yung sa female reproductive organs. Usually pa nga dapat kapag sa female mas maaga. Okay? But then again, pagka mga 35, dapat pinapatignan na yung breast. Doon naman para makita kung may possibility of developing ka naman ng breast cancer. Okay? So, ladies and gents, please remember that when you reach the age of, yung mga nag-aasawa na, or medyo pa 40s na, huwag niyong kakalimutan yung sarili niyo. I know that you will be, kumbaga, you will be occupied if you do have families in the future, or if you do have, or if you will have careers, no, na talagang demanding. Wag niyo kakalimutin yung sarili niyo. Okay? It's always good that you will have yourselves check once in a while, lalo na kapag yun nga, 'di ba? Pagka tumatanda na, kasi doon mas maraming nararamdaman, mas maraming pwedeng mag-develop kasi nga 'di ba nagde-degenerate na yung mga quality ng ating mga body parts. And of course yung mga hormones, and then 'di ba nga ngayon kasi parang in the generations nag-iiba na talaga yung kumbaga pagkakaroon or possibility of acquiring diseases. 'Di ba? Nung mga unang panahon naman kasi sinasabi ng mga matatanda na kumain ka lang na or magkaroon ka lang ng healthy lifestyle by eating fruits and vegetables, yung fish, yung mga healthy, marami sa kanila talaga tumatanda na na healthy and then long life sila. Pero meron ding pero ngayon kung mapapansin nyo, even at a young age, nagkakaroon na sila ng mga reproductive issues and it may also cause death. Actually, pabata na rin ng pabata ngayon ang mga nagkakaroon ng mga ovarian cancer. Okay, hindi talaga natin masasabi, but then again, yun nga, it's always encouraged that you do have at least a consideration of having a yearly check-up. Okay, hindi, I know it will be very expensive, but of course, parang prevention is better than cure kasi. Okay, mas okay na lagi ka na lang nagpapacheck kaysa na yung gagastusin mo sa pagpapacheck mo, igagastos mo sa ospital, which is mas mahal. Okay? So this is just a one of the diseases that we will be discussing relating to the reproductive systems. Okay? So let's move on. So next is the sexually transmitted diseases or the STDs. So this is spread by intimate sexual contact, and it can be caused by bacteria, viruses, and parasites. So when you say sexually transmitted diseases, it can be HIV, gonorrhea, syphilis. Okay, those are types of your STDs. Okay, so it can be transmission. Yun nga, kapag meron kayong sexual contact, kasi hindi nyo alam na may STD yung partner nyo. Okay, so it's always best that you practice or you will practice safe sex. Okay? So, kikilalanin nyo muna yung makakasama nyo, di ba? You should know kung okay ba siya, okay ba yung hygiene niya, okay? Kasi doon mo malalaman talaga kung talagang ang isang tao ay maalaga sa sarili niya. Okay? So, hindi ko naman sinasabi na kasi, di ba yung iba, pag sinabing love nila, mahal nila, ganun na lang, yung tanggap na nila yung buong pagkatao. But then again, you should also guard yourself. No, hindi porket mahal mo ang isang tao, yun na lang yung pagbabasihan mo kung bakit mo sila mahal. Pwede rin bilang isang alagad ng siyensya, okay? Lalo na kayong mga nursing students. Dapat kayo yung unang-unang nakakaalam kung ano yung dapat yung i-consider sa isang tao. Okay? It's just not the looks, about the attitude or syempre, kung ano yung ano bang pwede kong makuha sa tao na to. Kasi meron ng mga ganun guys, ng mga arrangements, okay? I know that, I am not very sure if it's also happening here in the Philippines, but I think in other countries na meron talagang super gusto nilang malaman kung ano yung lineage ng sakit ng mapapangasawa nila bago sila magpakasal. Mga ganon, di ba? Parang meron pa rin talagang mga praning, okay, bago sila magpakasal. Kasi ayaw nila na yung mga magiging anak nila magkakaroon ng mga sakit, ng mga talagang pangmayaman na sakit like cancer. Gusto nilang matrace yung mga background ng mga magiging partner nila before they consider marrying someone. Okay? So may tiwala naman ako sa inyong mga nursing students na hindi kayo basta-basta okay, na pumipili ng mga partner, okay, and then alam nyo din yung limitations nyo. But then again, it's always better that you practice safe sex, okay? So, the image that you see here on the right of your screen are actually some manifestations only of what you can feel or what could be the possible effects of, for example, acquiring gonorrhea, acquiring syphilis, okay? And how can SCD be treated? Okay? So, another type of SCD is the pneumococcal urethritis. So, this is the inflammation of the urethra that is not caused by gonorrhea, but it can be caused by trauma, insertion of non-sterile catheter, or sexual contact. So, usually due to infection with the bacterium Chlamydia trachomatis, it may go unnoticed and result in pelvic inflammatory diseases or sterility, but antibiotics are effective for treatment. Ito naman siguro, I think this is for someone who is so experimental, okay? Like, the insertion of non-sterile things, okay? May mga ganon, mga nag-explore. Choice nila yon. Okay? But then again, always be careful. Okay? Because of course, this, kunyari mga things na ginagamit dyan sa pleasure, kumbaga sa paghahanap ng pleasure, eh, hindi natin alam kung saan nanggagaling, kung malinis ba yan, kung okay ba yan. Okay? Because yan, ang magiging kapalit niyan, it may be a cause of a bacterial infection and then magkakaroon ka ng urethritis or pamamaga sa iyong urethra. Okay? So, ang kapalit ng pag-insert ng kung ano-ano ay ang pagkakaroon ng, or parang magiging dahilan pa kung bakit hindi ka pwedeng magkaanak. Okay? So, you should weigh all of the pros and cons of what you're doing. Okay? So, other than in the insertion of anything, of course, sexual contact, yun pa din. Okay? So, next is trichomoniasis. So, this is caused by the trichomonas. It is a protozoan commonly found in the vagina of a woman and in the urethra of the man. It results in a greenish yellow discharge with a foul odor, more common in women than in men. So, si trichomoniasis, ayan. Ganyan yung itsura niya, parang milky. Okay, and then kapag chinek yung vaginal discharge under a microscope, you will see a Trichomonas vaginalis trophozoite, or this is the egg of the protozoan. So other manifestations would be having a foul odor, itchiness and irritation on that part, whitish gray or yellowish green discharge, and then of course having a painful sex. So next would be gonorrhea. So it is caused by the bacterium Neisseria gonorrhoeae, which attaches to the epithelial cells of the vagina or the male urethra and causes pus to form. Pus is nana in Tagalog. Okay? So pain and discharge from the penis occurs in men and then symptomatic in women in the early stages and can lead to sterility in men and pelvic inflammatory diseases in women. So parang ito yung tinatawag nila sa Tagalog na tulo. Okay? So, sa men, there will be penile discharge and then burning painful urination. So, sa women naman, vaginal discharge and of course, the same burning painful urination. So, other things that could actually manifest, ayan, yung pagbubuo ng pus sa bibig yan and then ayan, sa eyes. Okay? So, kapag chinek yung inyong vaginal opening yan, maraming mga greenish thick discharge. Yan yung tinatawag nila na tulo in Tagalog. Okay? Next is the genital herpes. So this is caused by the herpes simplex 2 virus. It is characterized by lesions on the genitals that progress into blister-like areas, making urination, sitting, and walking painful. So antiviral drugs can be effective to combat this genital herpes. So ayan, nagkakaroon ka ng parang mga maliliit na butlig. So, this is the early stage and then the latter stages. So, yan. Para siyang warts. Okay, warts. This is the male, this is the penis that has warts and then ganyan sa female. Okay? So, siguro mas masakit tong genital herpes sa mga babae kasi blisters and then alam naman natin na ang female organ ay medyo mabasa, no? Syempre, ang sugat pag minsan nababasa, mas masakit compared to the males. Okay? But then again, syempre sa males naman, kapag dumidikit yan sa sinusuot na underwear at kumikis-kis or nagkakaroon ng friction, masakit talaga yan. Okay? Next is the genital warts. This is caused by a viral infection, very contagious. And warts vary from separate, small growths to large, cauliflower-like clusters, and lesions are not painful but sexual intercourse with lesion is. So, treatment includes topical medicine and surgery to remove these lesions. Ayan, ito talaga, mukhang warts. Okay? And then syphilis. So, this is caused by the bacterium Treponema pallidum. It can be spread by sexual contact. Multiple disease stages occur. Children born to infected mothers may be developmentally delayed and antibiotics are effective. So in here, you will see that there can be different manifestations in a patient with syphilis. So A and B are actually diffuse erythematous papular exanthem is shown over the abdomen in A, and lower extremity in B. And then in C and D, this one, it would show you multiple moist, hypopigmented, flattened plaques consistent with condyloma lata are shown in the external genitalia areas. And then E is inflammatory responses that can affect the hair follicles leading to moth-eaten alopecia. So pag alopecia, ito yung nag-draw yung hair or nawawala, nalalagas. Okay? And then sa F, you have oral mucosal patches. And then in G, you have pigmentary plaques shown over the buttocks of a dark-skinned secondary syphilis patient. Ayan, nakikita nyo ba? And then you have, in H is a psoriasiform syphilitic lesion as shown in the representative, this one. Okay? Pag sinabing psoriasiform, hindi talaga siya related sa psoriasis, guys, ha? Ano lang siya, parang look-alike. Okay? But this is a lesion found in syphilitic patients. And then next one would be acquired immunodeficiency syndrome or the AIDS. So this is caused by human immunodeficiency virus or HIV, which is ultimately destroys the immune system. So transmitted through intimate sexual contact or by allowing infected body fluids into the anterior of another person. So these are the different manifestations of having acquired immunodeficiency syndrome or AIDS. Okay, so before, wala pang halos talagang cure to, but now, evidently, meron na din. Okay, na habang tumatagal, of course, the technology and even science is already, kumbaga, guarded with medicine that can cure AIDS, but it will be a lifelong journey for them to be cured from it. Okay, so for symptoms for the acute HIV infection, you have fever, weight loss, malaise, headache, neuropathy, you have pharyngitis, sores, thrush, lymphadenopathy, rash, sores, myalgia, liver and spleen enlargement, and of course, nausea and vomiting. So, napakarami yung mararamdaman kapag ka may AIDS. Okay? So, this picture is very, it is a personal experience for me. Okay? So, in this one, on the left side, this is actually what you call the myoma or the fibroids in English. So, this was actually taken, or ito yung tinatawag na total bilateral kumbaga bisection of the uterus. This actually is the fibroid that came from my mom. Okay? Actually, magkasunod kasi kaming inoperahan noon. Siguro mga 3 years na or 4 years ago. So, ang mother ko, kinailangan niya ng matabiso. Sa Tagalog, tabiso ang tawag dyan. Tinanggal na lahat yung kanyang uterus because of these fibroids. Ito yung fibroids, yung parang mga mushroom. Nung una, isa lang yan, pero nung naopera siya, dalawa pala. Okay? So, ang nangyayari kasi, my mother is supposed to be ongoing menopause already kasi medyo nag-age na siya. But then again, ang nangyayari sa kanya is that continuous pa rin yung menstruation niya and napakalakas. Talo pa ako. Okay? Minsan halos himatayin siya sa sobrang lakas ng menstruation niya. Ganun kalala ang merong myoma. Kasi, guys, with myoma, kapag itong mga bukol na to o yung mga fibroids na to, they feed on the blood. So, the more na naglalabas ka ng blood, the more nilang kinakain yun at lumalaki sila. Okay? And if you look closely, parang may mga parang pimple pa dyan sa mga gilid na yan. Isa din yan sa mga pinakamasasakit na pwedeng magkaroon ang isang babae. Parang endometriosis. Okay? Pagka parang may mga patchy ka dyan. So, imagine guys that ang original lang talaga na laki ng uterus natin ay ganyan lang. This is just a small bedside pan. Ganyan lang siya kalaki. And imagine if a woman is pregnant, lumalaki talaga yan on the size of depende kung gaano kalaki yung baby. So, ganyan lang talaga siya kalit. Parang mas malaki lang. Kung if you close your fist, siguro mas malaki lang ng konti. Ganun lang kalaki ang uterus ng isang babae. Okay, yan na yun guys. Ito na yung pinaka-body ng uterus and then this is the cervix. Okay, so wala na. Even the ovaries of my mom has already been removed. So total tabiso talaga. And then dito naman sa right side, this is actually me. Okay, I was botched. Okay, because I had a paratubal cyst. So with a paratubal cyst, nagkaroon ako ng bukol sa pinagkabitan ng aking ovary and the of the uterine tube. Okay, so noon wala akong kaalam-alam. I have the symptoms I have was just irregular menstruation, as in talagang wala. Minsan 3 months, 4 months walang menstruation. And then lalo na nung malapit na akong maoperahan, I felt sharp pain dun sa ano kasi yan lower right ko, lower right na sa puson, okay? Masakit, parang bigla na lang may sharp pain akong mararamdaman. I always felt bloated, parang laging malaki ang tiyan, and laging, yun nga, feeling ko maraming hangin yung tiyan ko, and laging masakit, lagi yung tiyan ko. So, yun yung mga naging symptoms ko without knowing that I had this paratubal cyst. So, yung paratubal cyst ko, guys, was actually as big as an orange. Yun, yung medyo medium size orange. Ganun siya kalaki. And if I haven't, kumbaga, decided to have a check-up, kumbaga, magiging fatal yun. Kasi yung laman ng aking cyst ay water. So, kapag ka nag-burst yung cyst na yan, itong cyst na yan, this is the ovary. Yan. This is the ovary and then this is the cyst. Ganyan siya kalaki. Para siyang itlog, no? Mas malaki ng konti sa balot. It will be fatal kasi mas mabilis mag-travel yung toxic na fluid sa loob ng katawan compared dun sa mga buo-buo. There are actually different types of cysts. Meron yung mga parang may buhok ang laman, may ngipin, may mga ganon guys, iba-iba. Okay? But I will no longer be talking about them. This is just a, kumbaga, a sharing of what I have experienced, okay, when it comes to having a reproductive issue, okay? So, before I went to the doctor, I actually didn't have menstruation for about 3 or 4 months, and then meron lang ako spotting. Okay guys, one tip for the females, if nagkakaroon kayo ng spotting kapag menstruation, yung ina-expect nyo na mag-menstruate kayo pero spotting lang, and you know that you are not pregnant at all, have a check with your OB-GYN. Okay, there may be a reason why you're having spotting. Hindi siya normal. It's actually an indication for you to go and to visit your doctor. Okay? So, yan. After ko magpa-check up, guys, literally 2 weeks after my check-up, I underwent surgery agad to remove the cyst. Okay? So, after this one naman, yes, I was slightly, kumbaga, I was okay for about a few months. Naging normal ulit yung aking menstruation, but it was very, very painful. I cannot imagine, I cannot stand because of the kumbaga parang nag-adjust yung katawan ko na nagkaroon ulit ng menstruation. Dati hindi ako nagkakaroon ng, hindi sumasakit yung puson ko talaga, hindi ako nagka-cramps. Unlike the other girls na laging may cramps. I really didn't have, kaya parang kapag nagme-menstruate ako before, it's okay because I don't feel anything. Pero after my surgery, I felt parang mas masakit. Super sakit niya talaga. As in, hindi ako makatayo ng matagal. And, yan, I actually developed ngayon PCOS. It's maybe because of the hormone. My doctor said that I actually do have problems when it comes to the hormonal or having hormonal imbalances. And one more thing, I also developed endometriosis that I got from my mom. Okay, so ganun nga, medyo napapasa-pasa na ngayon yung mga genetics. So maybe when I reach around the age of 40s, I may want to have my uterus check again if I have naman myoma. Okay? Baka kasi naipasa din sa akin ng mami ko yan. Kasi nakuha niya din sa lola ko. So, naipapasa siya. Okay? So, this actually ends my lecture and sharing with you about the reproductive system. And thank you very much. Good luck and study hard for your final exam. God bless you all. And thank you for this wonderful semester. See you when we see you. Thank you.